Patients with severe conditions, particularly the elderly and those with pre-existing medical conditions, will remain as the priority when the government's mass testing for COVID-19 starts. This was clarified by the Health Department as it announced the country's latest tally for COVID-19, which has now hit over 4,900 cases. PTV's Mark Vitalco filed this report.
The Department of Health today confirmed 284 new cases of COVID-19, bringing the total to 4,932. 18 more patients have died, raising the death toll to 315, while 45 more people have been cleared of COVID-19 infection, bringing the total number of recoveries to 242, the highest recorded so far. According to USEC Maria Rosario Vergere, there can be more people who have recovered from COVID-19 as they are only monitoring those who have recovered in hospitals. However, they are still monitoring them and will soon include them in the data. Meanwhile, the DOH says they are now ready for the scheduled expanded COVID-19 testing tomorrow, April 14, but they clarified that it doesn't mean that anyone can go to a certified laboratory and get tested. The DOH has already released its guidelines on this matter.
Ang mga taong at risk at nangangailangan at siyang magiging prioridad para sa testing. Ito po ay ang mga pasyente o healthcare worker na may severe or critical o malulubhang simptomas at may history of exposure or history of travel. Pangalawa, pasyente or healthcare worker na may mild na simptomas, may history of travel and contact at considered siya sa vulnerable population, katulad po ng mga nakakatanda, may mga ibang sakit katulad ng diabetes, alta presyon at iba pa, at yun pong mga buntis.
The DOH added once the government reaches its target testing capacity of 8,000 tests a day, COVID-19 testing would also cover those who are not part of the more vulnerable sectors and health workers with no symptoms, but have exposure or travel histories. So far, there are 15 certified laboratories conducting COVID-19 testing, while over 20 are still in the process of accreditation. Meanwhile, the DOH is open to other diagnostic approaches like the gene experts who would speed up the country's testing capacity even more.
Inaantay po natin ngayon ang pagdating o deliveries ng 3,000 Cepheid gene expert cartridges na i-distribute po natin sa ating mga laboratorio na mayroong expert machines na compatible dito upang masubukan po natin ang approach na ito. Ang gene expert ay isang test na kasalukuyang ginagamit para sa diagnosis ng tuberculosis. Automated na ang prosesong ito at mas mabilis makakuha ng resulta kumpara sa PCR machines.
Mark Vitalco for The Nation.